Next up, we have Ann Whitmore. She's going to talk about just 10%, and it's a good follow-on to information obesity. She's going to talk about health and managing body obesity. So, Ann.
This is the story of how a small change can make a big difference to an individual's health, to our healthcare system, and to our economy. By reducing their weight just 10%, an obese person can provide a lever to solve a looming economic crisis. Just as a slight alteration to a rocket's course entirely changes the destination, we as a country have a choice and the power to change the course of our future. We have an obesity epidemic that is crippling our healthcare system. Our healthcare system is broken, and it is a huge drain on our economy. And our country is in a state of economic crisis. I'm going to show you how just a 10% reduction in obesity will impact that economic crisis, and how simple it is, given the right tools, to lose that 10%. Now, so why is it that we're having this problem? Our bodies are designed to store fat and conserve energy. We have the same genetics as those ancestors we had 10,000 years ago, but we live very different lives. Our food is high calorie, and we live a sedentary, high-stress lifestyle. Let's take a look at the growth of obesity in the last 25 years. Light blue, starting in 1985, is low obesity. Moving to tan, then orange and red, which is at least 30% of the population obese. Amazing. And this trend is making us sick with heart disease, type 2 diabetes, and on and on and on. What effect would just a 10% reduction in weight have on an obese person? 10%, I'm talking 20 pounds on a 200-pound person. It would affect, let's look at the health of that person. That person's risk of disease would be reduced 50%, 50%. And how would it affect the economy? In 2012, 5% of our country's pot of money, or GDP, goes to healthcare costs. So currently, healthcare costs are 5% of GDP. Of that 5%, obesity accounts for 21% of that. So what does this say about our future? At current rates of growth, in 2030, which is 18 years from now, just 18 years from now, our healthcare costs are projected to be 20% of GDP, 4 times what they are today. And of that 20%, how much will be caused by obesity? 42%. In 2030, 42% of our healthcare costs will be caused by obesity if we continue on our current course. That's double the effect that obesity has on our healthcare costs today. But what if the obese population reduced their weight by just 10%? Imagine the impact that we could have on our healthcare crisis and our economic crisis. Instead of doubling the healthcare costs of obesity, we would cut them in half. This is the effect that obesity has on the economic health of our country, as well as the psychological and the physical health of our citizens. Now, is a 10% reduction in weight a pipe dream, or is this a viable outcome? Clinical studies over and over again have shown that effective long-term weight loss occurs with a simple, nutritionally sound eating program, basic understanding of habits of health that are incorporated into our daily life, and support. It can be done. And just as a slight alteration in a rocket's course leads to an entirely different destination, so too a small reduction in weight makes a game-changing difference. With just a slight shift in behavior, just 10%, we can change the course of the health of our citizens, and we can change the future of our country's economic health. Thank you.
Thank you so much, Anne.